Welcome back to The Explainer. Today, we're taking a full architectural tour of the most complex, brilliant, and dynamic structure on Earth, the human body. Think of your skeleton not just as some static, boring frame, but as a highly engineered marvel of biological architecture. It meticulously protects your vital systems while allowing for some truly incredible mobility. So let's jump right into this masterclass on human anatomy.
Let me hook you right away with a crazy number, 270. You know, when you were just a tiny infant entering the world, you were actually born with an estimated 270 individual bones. Your structural framework was highly segmented, totally by design, to allow for all that rapid early growth and development.
But contrast that with this next number, 206. As a human adult, you've only got 206 bones. So where exactly did the rest of them go? Well, during the course of normal human development, a process that stays active all through childhood and puberty, many of those separate bones naturally fuse together. It's this fascinating fusion process that gives us the definitive 206-bone framework that we'll be exploring today.
Here's our roadmap for today. We've got 6 sections. First, the 206-bone framework. Second, the axial skeleton core. Third, anatomy of the skull. Fourth, the spine and rib cage. Fifth, the appendicular skeleton. And finally, number 6, the pelvis and lower extremities.
All right, Section 1, the 206-bone framework, building the foundation.
So our body's structural priorities are pretty clearly laid out here. On one side, we have the axial skeleton, which is made up of 80 bones. Its main gig, protection and support. It basically forms the long central axis of your body to shield things like your brain, your spinal cord, and your heart. On the other side, we've got the appendicular skeleton, which makes up the remaining 126 bones. These are your limbs and girdles, and their purpose is entirely different. They're specialized for enhanced mobility and locomotion. So think of it as 80 bones to protect you and 126 bones to move you.
Moving right along to Section 2, axial skeleton, the core.
Now, these 80 axial bones are distributed across some really key protective zones. We're talking 22 bones in the skull, 6 of those trainee auditory ossicles hidden deep in your inner ears, and exactly 1 unique U-shaped hyoid bone in the neck that actually helps us swallow. Moving down a bit, we have 26 bones making up the vertebral column, joined by 1 sternum in the center of the chest and 24 ribs. Together, these 80 bones act like a heavy-duty, armored cage, protecting all those incredibly vulnerable organs inside our ventral body cavity.
Section 3, anatomy of the skull, 22 puzzle pieces.
Okay, for all you pre-med and nursing students out there, I know you feel the struggle on this one. The skull basically acts like a complex 3D jigsaw puzzle that's been fused together by these jagged little suture joints. How on earth are we supposed to memorize all 22 of these complex skull bones? Specifically, I mean the 8 cranial bones that actually house the brain and the 14 facial bones that make up the front of the skull.
Looking at the skull from the side here, it's divided into the brain case, the cranium, and the face. You can clearly see the large parietal and temporal bones forming the walls. But notice that butterfly-shaped sphenoid bone right near the temple? It spans the entire width of the cranium and honestly looks almost like a specter or a ghost. And down at the bottom, we've got the mandible, which is your jawbone. It's actually the only movable bone in the entire skull, and without a doubt, the absolute strongest bone in your face.
To actually lock in those 8 cranial bones, we're going to use a fantastic mnemonic device. Ready? Ethan's fried Spanish pasta tempted Octavia. That gives us the ethmoid, frontal, sphenoid, parietal, temporal, and occipital bones. Just remember that all cranial bones are single bones, except for the parietal and temporal bones, which come in pairs. And here's a fun fact about the occipital bone. It sits right at the back of your head and covers the exact part of the brain that processes visual images. So in a way, you literally do have eyes on the back of your head.
Now onto the 14 facial bones. The rule here is actually flipped. All facial bones are pairs except for 2 single ones. Here's your memory trick for this one. My mouth's palate never likes zucchini and vinegar. That stands for mandible, maxilla, palatine, nasal, lacrimal, zygomatic, concha, and vomer. Those 2 single bones are the thin vomer deep in the nasal cavity and that super strong, manly mandible jawbone. The rest of them, from your zygomatic cheekbones to the lacrimal bones right near your tear ducts, they all come in pairs.
All right, Section 4, spine and rib cage, flexibility and protection. So, the crucial point to remember here is that your spine is a column originally made of 33 vertebrae, but they fuse into 26 distinct bones by the time you're an adult. Starting right at the top, we have 7 cervical vertebrae supporting your neck and allowing your heavy skull to rotate. Next up are 12 thoracic vertebrae in the chest region. Below that, holding up the small of your back, are the 5 really robust lumbar vertebrae. Finally, we reach the foundation, the sacrum, which is made of 5 fused vertebrae, and the coccus, or tailbone, formed from 4 to 5 fused vertebrae. As you can see, the spinal column is perfectly curved, which is a brilliant design to increase its strength and make upright balance actually possible for us. Between these bones sit intervertebral discs made of tough cartilage, cushioning our every single step. Also pay really close attention to those 12 thoracic vertebrae right in the middle. They correspond perfectly with our rib attachments, anchoring that protective cage around our heart and lungs. Speaking of the rib cage, let's break down how it's constructed. You've got 24 ribs in total, arranged in 12 pairs. But here's the thing, they aren't all attached the exact same way. The first 7 pairs are called true ribs because they attach directly to that sword-shaped sternum bone in the front of your chest using costal cartilage. The remaining 5 pairs, those are false ribs. 3 of them attach indirectly to the sternum, while the very last 2 pairs are known as floating ribs because they literally have no front attachment at all. This incredible, flexible structure is exactly what allows our lungs to expand dynamically every single time we take a breath.
Section 5. Appendicular skeleton. The limbs.
A single upper limb is literally a mechanical wonder, consisting of 30 separate bones. It all kicks off at the pectoral girdle with the scapula, your shoulder blade, and the clavicle, or collarbone. The clavicle is this cool S-shaped bone that acts as a vital strut. It holds the shoulder joint away from the body to maximize your arm's mobility. Moving down, we've got the humerus in the upper arm and the radius and ulna in the forearm. Finally, the machinery of just one hand requires 27 bones all on its own. 8 carpals in the wrist, 5 metacarpals in the palm, and 14 phalanges that make up your fingers.
And that brings us to Section 6, pelvis and lower extremities, the foundation.
The pelvic girdle is actually the broadest bone complex in the entire body. It literally takes the entire weight of your upper body and transmits it down to your legs. It's formed by 3 fused bones. The massive uppermost bone is the ilium. That sturdy lower bone, the one you are probably sitting on right now, is the ischium. And the anterior portion is the pubis. Together, they form a super tough protective structural basin for your lower abdominal organs.
Now check out the brilliant functional adaptation here between male and female pelvises. The female pelvis is uniquely adapted for childbirth. The angle of the pubic arch in a female pelvis is much wider, usually 100 degrees or more, compared to the much narrower angle of 90 degrees or less in the male pelvis. It is a perfect example of form truly following function.
Anchored right to that pelvis are our lower extremities. The thigh bone, or the femur, articulates with the hip socket. And get this, the femur is the absolute longest and heaviest bone in your whole body. Below that, protected by the patella or your kneecap, we have the tibia and fibula of the lower leg. And just like your hand, the foot is a wildly complex mechanism made of 7 tarsals in the ankle, 5 metatarsals, and 14 phalanges that form your toes.
Before we wrap up this tour, there's one really critical fact you've got to remember. Your bones are not just dry, inert structural supports. No way. They are incredibly dynamic, living tissues. Deep inside the marrow of your bones, a physiological process called hematopoiesis is happening constantly. Coming from the Greek words for blood and making, hematopoiesis is the continuous production of red blood cells. Your skeleton is quite literally a blood-producing factory that keeps you alive every single second of the day. So we've journeyed from the 270 bones of a newborn infant all the way to the incredibly structured 206-bone framework of an adult. We've seen exactly how those 80 axial bones protect you and how the 126 appendicular bones move you. Right this very moment, your skeleton is working as a complex system of powerful mechanical levers while simultaneously acting as a factory manufacturing the blood in your veins. It's an absolute masterpiece of biological architecture. The only question left is, what will you build with them today? Thanks for hanging out with me for this explainer. Keep learning, and I'll see you next time.